Breathing. It's something we do without thinking, a vital function we often take for granted. But for some, breathing becomes a struggle, a battle fought with each gasping breath. In critical care, when a patient's lungs can no longer keep up, a machine steps in to help, the ventilator. Ventilators are medical devices designed to assist or replace a patient's natural breathing process. They provide a steady, controlled flow of oxygen-rich air into the lungs, allowing the body to rest and heal. Think of it as a mechanical lung, a tireless worker that breathes for you when you can't. These machines are lifesavers, often making the difference between life and death in intensive care units around the world. From supporting premature babies with underdeveloped lungs to aiding patients recovering from surgery, ventilators play a critical role in modern medicine. For a ventilator to do its job, a crucial step is required: intubation. This procedure involves inserting a flexible tube, called an endotracheal tube, through the mouth or nose and down into the trachea or windpipe. This tube acts as a bridge, connecting the ventilator directly to the patient's lungs. Intubation is a delicate procedure, typically performed by trained medical professionals. It requires careful monitoring and precise placement of the tube to ensure proper airflow and avoid complications. Once the tube is securely in place, the ventilator can begin delivering breaths. The process may seem daunting, but it's a testament to medical ingenuity, a way to provide life-sustaining support when every breath is a struggle. Ventilators, despite their life-saving role, operate on surprisingly straightforward principles. These machines draw in room air, filter it, and then deliver a controlled mixture of oxygen and air to the patient's lungs through the endotracheal tube. The ventilator carefully controls the volume of each breath, ensuring the lungs receive the appropriate amount of air with each cycle. This controlled breathing helps prevent lung damage that can occur with irregular or shallow breaths. Furthermore, ventilators allow doctors to adjust the breathing rate, mimicking natural respiration. This control is crucial, as different medical conditions require specific breathing patterns for optimal recovery. Section 4. Oxygen. Finding the right balance. Oxygen, the very breath of life, is a critical component of ventilation. However, too much oxygen can be just as harmful as too little. Ventilators allow precise control over the concentration of oxygen delivered to the patient. Sensors constantly monitor the patient's blood oxygen levels, providing feedback to the ventilator to adjust the oxygen mix as needed. This dynamic adjustment ensures the patient receives the optimal amount of oxygen for their specific condition. Finding the right balance is a delicate dance, a testament to the intricate interplay between technology and human physiology. Ventilators, in this sense, become more than just machines. They become partners in care, working tirelessly to maintain the delicate equilibrium of life. Section 5. Ventilators, a lifeline in critical care. In the realm of critical care, where the line between life and death can be razor thin, ventilators stand as sentinels of hope. They breathe for those who cannot, offering a bridge over troubled waters, a chance to heal and recover. From acute respiratory distress syndrome to severe pneumonia, the applications of ventilators are vast and varied. They are essential tools in the fight against infectious diseases, providing vital support to those battling overwhelming infections. Ventilators embody the very essence of modern medicine, the relentless pursuit of life, the unwavering commitment to easing suffering, and the profound understanding that every breath is a precious gift.